This morning, we are releasing a previously hidden government report that undercovers the true extent of the family doctor shortage in our province. It's clear that Doug Ford has knowingly created a massive healthcare crisis in our province and that he's hiding the truth from you. This hidden government report suggests some alarming realities. First, at least 3 million people are at risk of losing their doctor in the next 5 years, with over 2,300 family doctors on the verge of retirement. Entire communities across Ontario, 205 of them to be exact, particularly in rural areas, don't have even a single family doctor who's signing up patients. And this report suggests that more than 1 in 4, 4.1 million people to be exact, are not signed up or rostered with a family doctor. These government numbers represent millions of Ontario families without dedicated access to what should be an essential service. And we know this is just the tip of the iceberg. And now it's time for Doug Ford to come clean about just how bad his healthcare crisis is. Parents are spending hours in the emergency room every time their kid gets sick because they don't have a family doctor. Seniors are having to resort to walk-in clinics for regular care because they don't have a family doctor. And generations of young people are growing up without dedicated medical care because they don't have a family doctor. How did we get here? It's simple. Doug Ford has deliberately underfunded our public healthcare system while simultaneously attacking the doctors, the nurses, and the PSWs who care for us. Worse still, he's worked to keep this information hidden. Just like the Greenbelt scandal, he hid the truth from you. The reality is, Doug Ford doesn't want you to know about the true extent of his healthcare crisis. He doesn't want to talk about the 12-hour wait times, the 3 million people about to lose their family doctor, or the thousands of emergency rooms closures under his watch. Doug Ford has 6 years to get it done for you. But today we have even more evidence that the only people he's working for are the people who cut him checks. So let me be clear. Access to a family doctor is not a privilege in Ontario. It's a basic right. Today's report sheds light on a healthcare system that is in crisis and shows a provincial government completely unprepared and uninterested in responding. This isn't just about what Doug Ford hasn't done. It's about what you need and deserve. You deserve a government that does more for you and for your family's healthcare needs. A government that does more to recruit, to train, and to retain family doctors so that every community across our province has access to quality and convenient care, whether you live in the city or not. It's time for a government that does more for you because at the end of the day, healthcare should be there for everyone in Ontario. Doug Ford has had 6 years to fix the crisis, but has only made it worse. Doug Ford can't get it done, but we will. Thank you, and now I'm going to pass the microphone over to Dr. Adol Shamji for his remarks.
Thank you. Good morning, everyone. Bonjour tout le monde. Everyone deserves a family doctor, their own family doctor. And under this government, we know that everything in healthcare has gotten worse. More patients in hallways, more wait times in emergency rooms, more people dying waiting for tests and surgeries, and of course, more people without a family doctor. About 1 million more people now than in 2018. Now, lately, we've been calling out the fact that 2.5 million people in Ontario don't have a family doctor. That's no access to any form of primary care whatsoever. Today, a concerned stakeholder from somewhere in healthcare has given us access to a report produced by the Ministry of Health. And truthfully, I haven't ever seen anything like it. It reveals that the scale of the challenge and crisis in primary care is far greater than we could have ever imagined. The report that we are sharing today shows every municipality or county in Ontario, and it gives the number of physicians who are rostering patients. It shows how many of those physicians are over the age of 60, and it reveals the number of people, including older people, who are rostered to those doctors. Looking at the ministry's own data, here's what it tells us. First, there are 2,336 doctors in Ontario who are above the age of 60. They care for over 3 million patients, all of whom are at risk of losing their doctor to retirement within the next few years. The government needs to plan for that, and I have no evidence that they are doing so. Second, in our province, the data shows us nearly half, 205, of all municipalities or counties don't have a single family doctor that signs up patients. Now, the technical word for that is rostering. So 205 municipalities don't have a single doctor who is rostering or has rostered any patients. And third, 4.1 million people across the entire province are not rostered to a family doctor at all. So let's talk about that very briefly. What does it mean to be rostered? Being rostered is that special relationship that's created when one patient is connected to one family doctor. In sports, if you're on the team, you're on the roster. Coaches, staff, and management will support and take care of you. Now, in family medicine, if you're on a family doctor's roster, you're their patient through and through. You can call and get an appointment anytime you like. You can remain their patient for years, decades, or until they retire. They know your file, meaning you don't have to explain your medical history over and over and over again. So what we're saying is that 4.1 million people aren't rostered to their own family doctor. Now, within that group, there might be some people who go to a walk-in clinic or a nurse practitioner. Some of them may even have a pediatrician because they're children, but they'll need a family doctor in a few years. A huge portion of that 4.1 million people don't have access to a family doctor at all. The bottom line is that this group is at risk. Many of them don't have a stable, predictable, secure relationship with their own family doctor. Now, these three statistics that I've shared are vitally important because they demonstrate that the scale of the problem that the Ford government needs to solve is much bigger than we thought. And this government has only made it worse. Everyone deserves their own doctor, and they deserve one close to home. And so we need to get doctors for the people who don't have one at all. We've always been talking about that. But we also need family doctors rostering patients so that those patients have that special, long-term, reliable relationship. And we need those family doctor connections to be close to home. That's not happening in 205 municipalities in Ontario. Now let me tell you how this really hits home. Just this past year, in May, 10,000 people in Sault Ste. Marie were de-rostered by their family doctors because Doug Ford did nothing to ensure that they had the funding and support that they needed. And so the community was thrown into turmoil. Today's numbers show that we will be seeing a lot more of that in the years to come. Now, yesterday in question period, I had the opportunity to ask the Minister of Health, how many doctors are rostering? How many will be de-rostering in the years to come? And how many municipalities don't have even a single doctor signing up patients? She knows the answer, but she didn't give it. They are hiding it, and today we are bringing that information to light. The government needs to come clean and explain why they think this situation is acceptable, because I can guarantee you these numbers would not be acceptable to an Ontario Liberal government. With that, we're very happy to take your questions.